Okie dokie, everybody. Welcome to the Brass Tacks Business Podcast. Today I'm thrilled to have Dr. Ehsan Jazini here on the podcast from Virginia Spine Institute. Ehsan, thank you so much for being on.
Thanks for having me. Happy to be here.
Absolutely. Dr. Jazini is a nationally recognized spine surgeon at Virginia Spine Institute. He is driven by personal experience. His brother had a severe brain and spinal injury from a car accident, and that was the moment that ignited his mission to transform spinal care through innovation, empathy, and tailored treatment. Dr. Jazini has dual training in orthopedic and neurosurgical spinal care. He specializes in advanced techniques, including disc replacement, robotic surgery, and augmented reality guided procedures. He's been included among the nation's top doctors for disc replacement by the ADR Spine Group, which is a curated list of the country's most renowned leaders in motion-preserving spine surgery. Beyond the operating room, Dr. Jazini work includes national recovery protocols, educating surgeons internationally, and contributing research that's improving patient outcomes worldwide. So, Dr. Jazini, thank you again so much for being on. I'm thrilled to have our listeners just really be able to absorb all of your knowledge and information. But first, I just want to learn a little bit more about your background and how you got into this industry and kind of what really ignited your passion for becoming an orthopedic surgeon.
Yeah, so, as you sort of mentioned briefly, the way I got into this is sort of the call. I see this as a calling. When I was 8 years old, my brother was 13. We got into a really bad car accident. We were on a family vacation, and I was actually sitting on his lap, and somehow I went underneath the dashboard. He went through the windshield, and 30 surgeries later, in the initial period, we didn't even know if he would survive. And he made tremendous strides. We actually moved to Dallas, Texas for a while. He was at the Scottish Rite Hospital there, and he made tremendous leaps to the point where now he can walk, he can communicate. He's actually part of an organization called Art Enables. I'm kind of giving a shout out to my brother Payman because he can actually does his artwork, and you can go online and purchase if you would like.
Awesome.
But seeing what the doctors and surgeons and physical therapists and all the caretakers over the years, what they did with my brother, obviously with the help of my own family, really inspired me to go down this field. And I chose spine specifically because I was really interested in the anatomy, the intricacies of it, and the huge promise that I saw. I mean, he had scoliosis surgery in the 90s. And what we can do now, a few decades later, is tremendously better. I mean, what he had was amazing for his time, right? But there's so much more that we can do. And I don't see my job as a job. I just see it as a calling. And that's the nicest thing. The biggest blessing for me is the opportunity that I got to be able to do this, right? I was in the right setup, in the right family, and with a little bit of luck and a little bit of hard work, I'm here. And so that's how I got into this, right? What drives me and gets me going every day is being able to provide that for my patients and giving them the tools for those other people and other families who are going through different types of, everyone goes through something in their life, right? To get them there, whether that's, hey, I want to be able to go do this hiking trip with my dad again, or it could be very simple, right? That's tremendously gratifying, and that's why I'm here.
Wonderful. And I know doing some research, you have specifically trained not only in orthopedic spine surgery, but also in neurosurgery. What kind of, were you just interested in both types of methods, or what kind of
Yeah,
sparked that interest?
I actually was really interested in neuroplasticity when I was in college. I studied neuroscience. We did research on monkeys, on how they learn new information, and the process of research was very slow. Almost too slow for my personality. I was a little bit more driven to kind of see results. So that's sort of how I made the choice to become a doctor beyond my personal experience. But I always wanted to study the brain and study the spine. And so when I went into medical school, I had a mentor who was a spine surgeon, and his brother was a neurosurgeon. And I did both rotations, orthopedics and neurosurgery, with the focus that I wanted to do spine or the brain. and I fell in love with being able to fix things, understanding the spine isn't just nerves, it's also the bony anatomies, the structure, the function, and it just that field, I gravitated toward that field, and that's how I picked orthopedics. But from the outset, I knew I wanted to be a spine surgeon, and so when I was choosing my fellowship, I did a fellowship that was actually joint neurosurgery and orthopedics. That means half the faculty were neurosurgeons, half were orthopedics, and they come to the field with different strengths and weaknesses, right? They have different focuses. Scoliosis, for example, was traditionally always done primarily by orthopedic surgeons, but the field of spine has matured now to the point where I think it's going to become its own distinct subspecialty beyond just the fellowship. Like after medical school, I can see within the next decade, you just pick spine instead of neurosurgery or orthopedics. So there's definitely an evolution because it's becoming so specialized. The technology is advancing so fast that and it really requires a lot of training to get to that level. And so that's how I sort of became an orthopedic spine surgeon with that type of background.
Well, I know you guys at Virginia Spine do an absolutely phenomenal job, and you, at the entire um, company as a whole, you have a lot of different services that you do offer for your patients. So, when you're in school or even in your fellowship, were there certain things that kind of drew you towards more disc replacement and things like that, or certain interests that, or maybe certain patients that piqued your interest into those subcategories?
Yeah, so as a spine surgeon and as a doctor, I'm always looking to see what is the best research-driven, data-driven tools that we can provide our patients to get better and better, right? And that's not necessarily surgery. Like a lot of times that's proper rehab, that's proper non-operative treatment. I would say 95% of our patients don't need surgery. And we firmly believe in that. Our practice is not just surgeons. We have therapists, we have neurology, we have neurosurgery, we have orthopedics, we have physiatry. We have the whole gamut because we understand it takes a village to take care of these patients. Most surgeons don't need a structural fix. There's other avenues like biologics, PRP or bone marrow aspirate stem cells. We've made tremendous advancements. And the more you've done it, the more research that we're collecting and seeing those outcomes. And so what drives me is ultimately that we can improve the quality of our life of our patients, and we do it in the best way in terms of the least amount of downtime so that they can get back to their life and their families. And so what's driven me to disc replacement surgery, for example, as one of the things that you mentioned is, well, do we have to do it just the same way, like just fuse someone and not let them that motion segment move? And sometimes it's beyond to the point where you can do a replacement and fusion is the right answer. But the more skill I've and experience I got into this field, I realized that more and more patients can actually benefit. And sometimes it does take a lot more work. Uh, you have to sometimes build the patient's bone back up. Sometimes you have to use other tools to enable them to still get a replacement or techniques that have been advanced, right? The technology has come there. And so that's what I'm looking for is what do I do to get this patient the highest quality of life that I would want for myself or family. And if I need to go learn a new skill, I will go learn it. I want to make sure that it's vetted, making sure that we can research it. And once I feel like it's past that important litmus test, right? We don't want to just do experimental things in our patients. Then I want to be able to enable my patients to take advantage of those advances.
So we're going to definitely touch on a lot of that. I'm glad you brought up the PRP, the stem cells that you guys offer at Virginia Spine. Um, are there different, just for our listeners, are there different types of disc replacement? Because I know that you have now performed your 100th pro disc cervical replacement surgery. So are there different types of disc replacement? And can you explain to our listeners the benefit of a disc replacement and preserving that joint motion versus just the typical
Yeah, so
fusion that happens?
there's multiple types. There's multiple implants in the country in the U.S. There's about 8 implants that are FDA approved. They have different characteristics, right? Their materials that they're made. Some of them are ceramic, some of them are titanium, some of them are cobalt chrome. They move different amounts, right? Some are more constrained, so they're more rigid. Some are more flexible. And so I'm not tied to one or the other. I'm tied to what's best for that patient. And so we look at the person's anatomy. How much motion do they have? What's the morphology of their bone? What's their lifestyle? What are the demands of their body? Are they like an MMA fighter, or is this person just wants to be able to go for a hike and walk their dog, right? Those are different demands and different needs. And what we need to do is personalize that. If they do need a replacement, implant to the patient. Your other point was on regenerative or on,
Um,
sorry.
well, I think I do want to talk about the regenerative as well. So, can you explain to people kind of the benefits of PRP and the stem cell regenerative therapy that you guys do?
Yeah, so,
Um,
PRP has been around for a long time. I remember when I was a resident, and let's just step back. So PRP is platelet-rich plasma. You're taking the plasma from the blood that is rich in platelets and growth factors, and you're putting it into a structure that needs extra time healing or has had difficulty healing. You're trying to recruit the growth factors and the blood flow. And it was traditionally, when I remember when I was a resident, it was still experimental for like things like tennis elbow or Achilles tendonitis. And uh, because there wasn't a lot of research out there, like, oh well, you can't really do it for everyone. It was very selective, and now the field has moved to the point where it's pretty well understood and it's accepted for that. And spine is one of the last frontiers where we're seeing the benefits. Let's say your ligament between the inner spinous ligament between the spinous processes, those bones in the back of the spine, are injured. We can use it for the facet joints. If the facet capsule is overstretched, we can use it for the disc itself. If there are annular tears of the disc itself, we can use whether PRP or intradiscal bone marrow aspirate concentrate, which is another type of regenerative treatment. All of these we've found tremendously successful. We did a study with 3-year follow-up with 80% of the patients showing improvement, right? And it has a great utility between the non-operative holistic treatments like chiropractic treatment or physical therapy all the way to surgery, right? There's this happy medium where the structural issues isn't quite warrants a disc replacement surgery or other types of surgeries that we do, but they're still limited in terms of their quality of life and things that they're doing. And oftentimes, what I find is that those patients, and I just had my own uncle do that for years. He just didn't want to go on ski trips anymore. He didn't want to go on a hike anymore, right? I actually did his intradiscal stem cell 4 years ago now, and I've gone to 2 ski trips since then. I just saw him in London for my cousin's graduation, and he's like, "Yeah, I'm not getting those attacks anymore." And he was sort of almost to the end of the pathway of even being able to do it. So I've seen it in my own personal life because I've done it on my own uncle. So I'm a firm believer that there's a role for it, right? And the data is becoming more and more prevalent as more people are accepting this, just like PRP for, let's say, tennis elbow. I remember 15 years ago when I was a resident, right? I remember it was still, a question mark.
and
So
so
anyways,
with
it's really exciting. It's really exciting that we can actually offer this now.
and with the if a patient's coming in, they have no idea if they're I mean, obviously, I'm sure I get patients all the time that I refer to you guys because I do. For everyone listening, Virginia Spine, I think you guys do a very good job at not going to surgery first. You guys are always looking at the patient, obviously their lifestyle, like you mentioned, offering other non-invasive techniques as well as the disc replacements or the fusions and the more invasive treatments. So for anyone listening that has possibly, say they have a disc herniation and they're scared to come see you, for a consult, how do you guys determine whether a more non-invasive or a PRP, a stem cell, is going to be best for them versus saying, okay, hey, it might be time to start thinking about a surgical procedure?
It's a great question. So the first thing is listening to the patient, meeting the patient where they are, understanding how long it's been going on for. What have they tried? What are their goals? Like the most important thing for me is understanding what does this patient want to do, right? What is it that is inhibiting them, and making sure it's really the disc herniation is the actual problem, right? So a lot of times, we see patients who've had failed surgery or failed treatments, and it's because they didn't get a comprehensive look they weren't heard. And so there's a subset is misdiagnosis or incomplete diagnosis of a problem. So that's number one. Listen to your patient and understand what the issues are, get all the information, get all the facts. It's very rare for me to discuss any kind of treatment on the first visit, almost never. Um, and so the most important thing is that you see someone who's going to take the time to understand what the issue is. There's a lot of times you have to do additional testing, whether that's imaging with the MRI, right, or X-rays dynamically, or sometimes we'll do discography to understand which discs are actually painful and how bad is the tear. To then try to go down the pathway of understanding, okay, is it a regenerative? Is it too far gone? To get regenerative, and then we're talking about, let's say, disc replacement, right? And this is only for patients who've failed a very good round of holistic treatment with therapy or chiropractic treatment. Disc replacement, kind of going back to your initial question, it's kind of like versus a fusion is like if you had a car with four wheels and each of them are moving, right? If one tire needed to be changed and you didn't change it, you just said you have to drive on three tires. Well, what's going to happen, right? They're not going to last as long. I mean, it's not a perfect analogy, but it's just not going to go as well because naturally we all have wear and tear as we get older, as we do more things, right? The more you drive your car, the faster you're going to have to change it. And so the main advantage of a replacement is not just that you preserve that person's functionality and motion there, it's really reducing the rate of the breakdown of the other levels, right? The spine is meant to move segmentally, but also in unison. And so when you take emotion away, and the more levels you have to fuse, the more negative effects are you going to have, right? And so it's about the longevity of the treatment. Sometimes that's just not an option. That level, let's say, doesn't move because it's too arthritic, or they're having major neurologic issues like weakness that you have to still do the fusion. So I don't want to badmouth fusion because it has a role for a lot of patients. It's going to improve their quality of life, and it's worth the benefits far outweigh that negative, which is okay, you lost motion at that segment. But oftentimes those patients actually don't move that segment anymore. So it's really important to be honest and demonstrate through the facts, which is the X-rays, the dynamic X-rays that we get. Their CAT scan. A lot of times I'll get a CAT scan to really see the bony anatomy really well, to lay out all the options and make sure the patient understands we're trying to come up with their feedback and input what's the best treatment for them, right? Because sometimes that risk benefit may not be there for them, right? So that's where it's a two-way conversation, and oftentimes even more than two people, it's their caregiver, their significant other has to be part of this decision making, because it's going to take the whole village, like I said, to get someone through this and get them to a better quality of life. It's not just you, the surgeon, and the patient, right? I have a phenomenal team that supports me, and I couldn't do my job without them.
And I know we've spoken before, Dr. Jazini, about you guys also offer like a hybrid type surgery where you do a fusion and a disc replacement. What are the benefits to that, and what type of cases have you seen that benefit?
Yeah, so that was kind of back to my point is you have to personalize it, not just to that patient, but you got to personalize it to each level. So let's say someone has three discs that are worn out in their neck and it's causing significant pain, disability, nerve issues. But let's say one level, the joint in the back of the neck is pretty arthritic. That means it's stiff and it's not moving, and they have pain when they move their neck. But the other two levels, they have healthy joints. It's just a disc problem, right? So that patient is like an example of someone who we can do what's called hybrid. So we replace the ones that we can replace and where it's going to be a huge advantage for them. But if there's one that's too far gone, we can fuse it. So that's what hybrid means you're not just doing the same thing for one level. Or we do that with regenerative. Let's say there's one disc that's too far gone to do regenerative and needs surgery, but the other discs are painful, but they're not even bad enough to do a replacement. We can do stem cells for them. So that's what I mean by hybrid and personalized care is you want to just treat each level as part of a whole, because you got to look at the whole patient, but also individually, what's the best thing for that level? Because all of these are interrelated. And if I did a two-level fusion versus a hybrid, that's a big difference for the patient. Or two-level replacement, one-level fusion, you're still preserving all that motion and prolonging the life of their other discs. And the data on that is very clear. Disc replacement surgery, because it's a newer technology, is the number one studied implant in all of orthopedics and neurosurgery, by the way. And a lot of people don't realize that, because the insurance piece of this, we can get into that on another topic, hasn't caught up, right? So like now it's still considered experimental for a lot of insurances to do a hybrid, right? Because it just wasn't studied for the FDA. The FDA, they did one level trial and then two level evaluation, right? So the insurance companies are like, well, hybrid wasn't studied, so we're not going to approve that. As I'm just giving an example of some of the other issues that we see, and for why patients seek us out, because we can provide these other technologies and treatments that are customized for them that may not be available in a widespread manner.
And I love that you guys at Virginia Spine are definitely at the forefront of this, surgical technology. Um, and I want to talk about that specifically because you guys
Sure.
had a great event where you invited a lot of us chiropractors out to your
Yeah.
office. You showed us the robotic surgery and all the amazing and really cool technology that you guys are using. But on your point there, what does the research show, or even in your personal experience, just kind of with success rates with a standard fusion versus a disc replacement versus maybe PRP and stem cells? And I'm glad you brought it up. I didn't even realize that you guys do both at the same time. So you will have a patient who might go in for a surgery, but also you might combine the surgery with a stem cell injection or a PRP as well, which is interesting.
Yeah, for sure. I mean, the data has been very, very, very good. I would say with disc replacement surgery, of all the ones I've done personally, I've taken patients back twice in my career. So that's like a 99% success rate in terms of not needing another surgery. Um, with fusion surgery as well, I mean, it's very, very successful in terms of very low complication rates. The issue of fusion is really about the long term, right? So you're not going to see, if the fusion's done well, and we use technology, the approaches that we do a lot of that, what we call approaches from the front, and then using robotics to make it much less invasive. So we're not causing any um, extra injury to the tissues, right? To protect the other levels. But you're going to see the end result of that at 10 years, 20 years, 30 years, as the wear rate is higher with the fusion. And that's why, if a replacement is an option, I will always do a replacement. Sometimes I'll have to even get the patient to work on their bone density so I can still do the replacement for them, right? So I'm a firm believer of using the technology and the biologics to get the patient there if we can. And it's very important for me as a guy who's always done research, throughout my training, whether in medical school or residency, to also be involved in research, because to me, you have to have the data. And if you don't have that quality control, then you don't even know how to make that next leap, right? It doesn't give you the confidence to make the next leap. And then, you don't want to just stop at the technology. You also want to figure out, how do you advance someone's recovery? And so enhanced recovery after surgery is a protocol that was in general surgery that we have spearheaded in the field of spine on a national level. And now we just did this massive study with over 50,000 patients with the support of HCA, which is the biggest hospital system in the country, to study that. And we found that with these enhanced recovery techniques and protocols that involves before the surgery, with the help of the anesthesiologist, physical therapist, and our own staff and team, we can reduce the need for opioids, the painkillers. We get the patient up faster, and we get them recovered faster. So when you put all of these different aspects into your care, is how you get the better result. It's not just, hey, I use robotics, or I use this new fancy tool, and all of a sudden, I see that a lot, right? Oh, this guy is the ultrasonic surgeon, or this doctor is the robotic surgeon. You don't want to be pigeonholed and be defined by technology. You want to be you want to be defined that you're going to provide the best care, and you're going to have all the armamentarium, or the tools, to get, not just to help figure out what the problem is, and do the right fix for the patient, but also show them how to get that recovery done, right? Which is why we have our own enhanced rehab team, or I have individuals such as yourself who I know who are very good chiropractors where I can get the patient to, right? Because we get patients from all around the country. And so like yesterday I called a therapist who is in Chicago because my patient came in and saw me from Chicago and he had a 3-level lumbar disc replacement and I needed to speak to the therapist. So making sure they understand what we did for this patient. So you can't stop at, hey, I did your surgery, good luck, right? You have to coach them and give them the tools so they don't re-injure themselves and that there's longevity with whatever treatment that you're doing.
Glad you brought that up, Assam, because so many clients come to me and they've had past surgeries, and I ask them, "Oh, did you do the PT or the rehab afterwards?" And so many people tell me, "Oh, no, I didn't do it," or "Oh, I should have stuck with it longer." And I know you guys at Virginia Spine have a very good rehab, protocol center in your building. What are some of the types of things that you guys do at Virginia Spine for rehab post-surgical patients to help their recovery improvements?
The most important thing is having the right individuals, right? As you know yourself, it's a training, right? It's being trained in manual therapy, knowing when to use technologies. Let's say something called blood flow restriction. It's a technology used to help stimulate the muscle from growing in terms of strengthening without loading those joints when they're still recovering. It's using things like lasers, using things like hyperbaric chambers. Um, but again, it's not, I don't want to get too far down a pigeonhole of this technology versus that technology. Is you have to have a philosophy of care, and then you have to know how to use all these tools. So they have like 10 different tools in our rehab unit, including aquatherapy, to get the patient and individualize it for that patient to get them there, right? Like I'll give you an example, like stress fractures for adolescents in high school, right? It's a very common injury. Um, Oftentimes that injury happens because of overloading of that bone in younger athletes. And so it's not just a simple of, okay, I'm going to put bone marrow. So one innovative thing that we do is we take the child's bone marrow concentrate, try to get that area to heal, but then it has to be in conjunction with therapy to help eliminate the root cause of the problem, right? A lot of times, as you know, those patients have tight hamstrings, they don't have good hip flexibility, and they're doing their strengthening in the incorrect form, which causes the injury. So then I'm interested in not just treating that initial problem, but also avoiding re-injury of that same issue. And I can't do that without our therapist or without a protocol that I can then teach other therapists. So I have a network of therapists that I work with because for me, I'm a very strong believer that without the right rehab, I could be the best surgeon in the world and do everything fancy and really well, and it still won't work, right? Because you can't fight biology. If someone malnourished and you do surgery on them, no matter what you do, if that wound doesn't heal, it will get infected, right? And so nutrition and the rehab part is a critical part of it. You can't fight biology. You have to think holistically, and it doesn't end at the scalpel.
I'm so glad you said that, Dr. Jazini. For all of those you who are listening, make sure you do your rehab after surgery. Tell us more, Asan, about some of the robotics that you showed us at the event when you had us all out. Explain that to us and how that
Sure.
is helping you guys with your surgeries.
So the best way to explain robotics is it's all about precision. And robotics has been around spine now for almost 15 years. And VSI, through the leadership of myself and my partners like Dr. Good, has really come a long way um, in terms of what it can do. Right before, it was just a fancy guide to be able to put the screws. Now we can use it to not just put screws, those anchors that we have to put for the spine more accurately. Now we can prepare the bed for the fusion if you're doing a fusion. Now we can use it to help make disc replacement surgery safer. Now we can use it to help decompress the nerves in a more safer way. So it really elevates you to be able to do the same exact fix that, let's say, my brother had, but do it much less downtime, faster recovery, less risk of injury to the surrounding structures. So it's a tool, but it's a very valuable tool. And it gives my patients more mileage in terms of how long to give them more longevity. But actually, as a surgeon, it also gives me more mileage, believe it or not, because it makes it much more refined and delicate. I'm not there, mobilizing all this muscle and causing all this other secondary injury to get to the root cause of the problem, right? That's where robotics and augmented reality, which is another technology that we use, really has helped us to hone in, fix the problem, plan for the problem, do more customized treatments for patients. Because it's not just the technology, the robotics, it's the computer AI platform that it has that allows me to get much more precision in terms of the tools that I need before I even do the surgery, right? I can kind of pre-plan the whole thing and see what the end results are going to look like before I do it. So that's where these technologies, especially as they become more merged and more advanced, are really becoming game changers for our patients.
And so, with those extremely specific technological advances, the downtime is lessened. Is that just because there's less trauma to the tissue, less things going in, so the patient's able to recover faster just because it's so much more delicate to the body?
Correct. Yeah, I think for a lot of patients, they've been exposed at this point to, like, think of a gallbladder surgery that we used to do in the 90s, like through an open scar, or appendectomy, compared to a laparoscopic surgery, or the one that they do now with the robot, the Da Vinci robot. Right? I had an appendectomy 5 years ago, and I was operating 3 days later, right? Because it was done through these portals. Spine surgery is the same thing. I mean, my brother was in bed rest for 6 months after his scoliosis surgery. My patients go home 1 or 2 days later after scoliosis surgery. I mean, that's, if I told my mentors back in the 90s that we can do that now, I'm sure they would be shocked, right? I mean, that's tremendous that within a few decades. I mean, if you look at the videos from the 50s in Germany when they were doing these surgeries, I mean, the patients were like in these total body casts, and they were in these like specialized stretchers, right? Because I mean, it's just because the technology has just really transformed what you can do. I mean, for some patients, it was a death sentence, right? If they had a spine injury. It's really tremendous what you can do for your patients now, and it just keeps getting better.
Well, it's funny because at the time it was probably super advanced, just like the robotics and the AI is now.
Oh
But we
yeah.
look back on it only a couple decades ago, and it looks barbaric. What do you what do you predict? The future has for spinal surgeries. Any technological advancements that you see in the next decade or two?
I think there's two different pathways. I think the biologics is really going to be the most transformative aspect of spine surgery. It's actually, I would even call it surgery, just feel the spine, because it's really going to elevate what we can do for a huge subset of patients, where right now it's, especially for surgeons who don't do wrist disc replacement, it's like, just deal with it, right? Manage it, push it off as long as you can, because they don't want to fuse their patients in their 20s and 30s and 40s, right? It's like if you needed a hip replacement before hip replacements were out, and the only option was, I'm going to fuse that joint, or you just deal with the pain. What are you going to do? Most people would deal with the pain, right? Spine surgery, believe it or not, which is, I still find a little bit crazy at this point in day and age. I see it all the time. Patients come in, they're like, yeah, I have this disc issue in my back and I've had pain for 10 years. I see all these surgeons, and they say, well, just deal with it. Just do therapy, and because the alternative that they can do, I mean, is fusion, right? And so they don't want to take the person's motion away because they know the longevity of the other levels is not going to be great. That's the data, and that's the good surgeon that's telling them that, right? Someone that I trust, right? And so I think that biologics, as that becomes more prevalent and well understood and more mainstream, that's going and is better as the technology gets better. I think it's going to be transformative, and I think it's getting to the point already, because as you have these things like ChatGPT and the internet. I mean, I have patients come in and seeing me because they're they're doing their own research. They're not taking the first or second or third opinion and saying, okay, I just have to deal with it. They want answers, and they have answers. I mean, it's not like this stuff isn't studied, right? It's well established and well documented. AI, one of the advances of AI has actually been able to disseminate information in a better way for patients. And so we have patients from all around the country who are coming and seeking, you know, specific treatment. And it used to be that, we had a lot of misinformation out there, but as AI has gotten better, a lot of times what patients are saying to me, or they're asking for, is it's pretty close to the truth, in terms of, like, they're pretty, like, almost dead on. Do you get what I mean? Like, in terms of what is it that they're asking, and even their diagnosis is more correct, versus like 10 years ago, a lot of times it was just a lot of misinformation. I don't know if you remember the days of like laser spine surgery
Yeah, yeah, yeah.
and all that misinformation that was associated with that. So there's been tremendous progress. The other piece of it is really AI and robotics, and the evolution of those two, of those, the hybrids of those two coming together, is just going to keep making the surgery safer. It really is going to make it even less invasive, ultra less invasive, in terms of being able to treat the problem without causing downsides to the patient, right? Without causing other problems for the patient.
And in your opinion, these doctors who may be good doctors and they may be great surgeons, but they, maybe only do fusions. Is that just because, like, are they teaching it in schools now? Since you've been in school, like, are they teaching you guys, surgeons in school, about the robotics and the AI now, and that's why it's becoming more prevalent?
It's slowly creeping in.
Mm-hmm.
The the issue is with specifically with disc replacement versus fusion, it's a numbers game. It's the insurance companies, like I said earlier, haven't come around to reimbursing them either whatsoever, or reimbursing them at a much lower rate. And until there's parity in that issue, which makes no sense, by the way, right? I mean, a disc
And they're
replacement surgery is more work, it's more technically demanding. You have to get the implant perfectly centered, you have to do the releases, versus a fusion, you're just trying to get that segment not to move anymore. So if the cage is like 4 millimeters to the right or left, there's really no consequence for the patient, but it pays 50% more, 40% more. I don't know the exact numbers. So you're not going to get that field to move unless there's In fact, it should be the other way around, right? I mean, in terms of the insurance piece. So that's part of the problem. The other is people just get set in their ways. I remember some of my own mentors, phenomenal surgeons, and after a certain point in their career, people are just like, well, this works in my hands, and I'm not gonna, whether that's just because they get comfortable and they don't want to learn something new, like it's too far gone for them to go then relearn something that they are not familiar with. And there's some truth to that, right? For example, like, there's a learning curve with anything. So unless you do a lot of something and you're believing in something, I wouldn't want someone to do a disc replacement once a month, for example. There's just not enough reps for them to get good at it. You don't want to go to someone that does hip replacements 10% of the time, right? If you need your hip replaced, you want to go to the guy that does what they do. They do, not that they just do it, they do a lot of it. They've seen different scenarios, different patients, different anatomies, different age groups.
Yeah, it's just like
That's how I would
anything.
pick. Yeah, like anything else, you want a
Yeah,
guy who does a
the more
lot.
reps you've got, the more adept you're going to be at your
Correct.
craft.
So there's some truth to the person who's in his 50s and hasn't really done replacements. For them to pick it up in the last decade of their career, it's hard for me to blame them, right? So either you have this big philosophy of care, what I said from the get go, you're like, what's the best thing for my patient? How do I obtain that knowledge and expertise, and do the research and collect the data? We have a registry for all our patients to make sure we have that quality control. And you have to be part of a system, like a big practice with other partners. Like, we have a Friday conference every Friday. It's an education conference for our staff, but also for ourselves. It's about presenting our cases to our partners and having, almost like every patient is getting like 3 or 4 opinions. right?
Yeah.
You're
Yeah.
vetting yourself and having an internal, it's so important, right? If you want to just, if you just buy, if I was just by myself in some silo in some state, there's no way I could be doing these things and doing them well as I could as being part of a group.
Sure.
That's where there's advantage of being around like-minded people in an institute like VSI. That's where it can elevate you to that next level.
For sure. You are who you surround yourself with. Um,
For sure, for
and I
sure.
know you go around the country. I know you mentor and you've trained many surgeons. What are some of the, important surgical principles or philosophies you try to teach your other docs about around the country?
Yeah, so one of the areas that I've done a lot of teaching is disc replacement, right? When to do it, how to get the expertise. We have surgeons fly in to observe me do it in the hospital, in the cadaveric lab, right? You when you want to pick up a new technology and the message is you got to learn it. You have to go watch someone do it. You got to go understand. You don't want to make the same pitfalls that you don't want to repeat the same mistakes, right? So even when I was doing disc replacement, when I first started, that's exactly what I did, right? I went out and first try to understand it, look at the research, then I went and observed someone else, right? So uh, it's an honor for me to be able to pass that on now that I have that experience. And my message to other surgeons is don't take no for an answer. Like just because the insurance company is inhibiting you, we can't stop there. We got to do what's best for our patients. We have to seek the truth, seek the best treatment, and find the avenues that allows us. Otherwise, the field is just going to stagnate, and it's going to give all of us as a field a bad name, right? Spine surgery, unfortunately, is still associated with the spine surgery that like my mom or my brother had, right? Where people expect, okay, I'm getting a fusion and I'm going to be in bed rest for 6 months, and the truth is, it's not like that. If it's done well, it's not like that.
Well, after visiting VSI, I was telling my wife Jasmine she's got multiple disc herniations that we've been able to manage over the years. But we know that I've told her, I said, if you ever need surgery, I'm sending you to Dr. Jazini at Virginia Spine because you guys just have such a culture of going above and beyond, for your clients, for your patients, really giving them the best care possible. What is one thing, like you mentioned, patients are now coming to you. They have a lot more answers now with AI and technology. But what do you feel is the biggest misconception that, your patients have when they come to you seeking, options for a surgical procedure?
One of the biggest misconceptions is if something hasn't worked, that means it still won't work. And what I mean by that is there's this trust issue that has become a part of the, unfortunately for that patient, right? Their experience, you can't negate that, right? They've been told something, they went through a gamut of tests or injections or even surgery, and they've lost hope. And so I don't know if I would call it a misconception. It's that's their reality, right? And my job is to get the information, get the data so I can inform them, and then hopefully I can give them hope, right? Most of the time there's hope. It's not, hey, I'm just going to give you a spinal cord stimulator just because I put my hands in the air. I mean, I can't think of a single patient with which I recommended that for them. You know what a spinal cord stimulator is? They put those leads in your spine to kind of trick your body. I mean, it has some utility in a very small subset of patients,
It
but
just turns off the pain essentially, right? But it doesn't really
you're
fix the
masking
problem.
the pain. Yeah, you're
Right.
basically trying to mask overload by sensory overloading their spine, their nervous system. So one big misconception is really just trying to re-engage the patient and give them hope. Okay. Number two is if if you had something fixed in your spine, right? Because the spine isn't just one thing, it's multiple discs, multiple joints, and multiple nerves. And the analogy I give patients is if you get a cavity in your tooth and your dentist fixes that cavity, you get it filled, and 6 years later you get another cavity somewhere else, you're not going to be like, oh my God, like I shouldn't go to the dentist now because I got another cavity. The spine with life and with genetics, a lot of this is genetic, things break down. And so don't lose hope just because something else is brewing. A lot of times doesn't even mean you need another surgery. It just means there's potentially another problem. So we gotta take the time and do the right workup. There's very few things I've seen in my career where we couldn't at least dramatically improve the person's quality of life. I'm not God. I can't undo every injury and every nerve damage that's out there. It's very rare that we haven't been able to improve someone's quality of life. And so that's probably the second misconception that's most prevalent that I see.
And so, for somebody that's searching out a spine surgeon, if they can't make it to VSI, for any of our listeners, Dr. Jazini, what are some things they should look for in a spinal specialist, or any red flags that they should maybe get second opinions or third opinions
Sure.
from?
I think getting multiple opinions is always a good way to go. I mean, they can always do a consultation with us if they're not in state in Virginia. They can always do a consultation to get another opinion. That's the first answer. What they should be looking for is what kind of training does this person do? I've had. Let's say they're looking for disc replacement. Does this person do a lot of disc replacement surgery? I mean, that's the simple answer, right? The problem is when you go on websites, people just put whatever they want on these websites. You have no idea. You have to do a lot of digging. I know there are some really good Facebook groups. Now, AI has made this a little bit better in terms of the quality of the information that the patient's getting. But ultimately, you got to go seek out a person. You got to give the other physician a chance, right? You got to sit down and talk to them and seeing, do they listen to you? Do they take time to listen to your thoughts? Do they give you a good physical examination? Are they taking their time to review your imaging? Do they take time to explain what they think the problem is? I mean, I'm shocked how many patients come to me and they're like, yeah, the doctor just kind of came in and kind of just walked out and said, I can help you or I can't help you, but there's no conversation, right? I mean, it seems pretty elementary that you would think these are the things I wouldn't have to say that, but
It's very
unfortunately,
common. It's very common.
this
Yeah.
is what I'm explaining, this lack of bedside manner and just what I would say to one-on-one in terms of a good doctor-patient relationship. If they get past those things, then you can get into the higher level stuff. Like, well, do they do disc replacement surgery, right? Because sometimes patients are like, yeah, the surgeon said they don't do disc replacement surgery, but that stuff doesn't work. You should just get the fusion. And I'm like, well, if they don't do it, how would they know if it's good or not? Or like, or what was the argument? Like, right? So take time, research the person, take time in terms of your visit. And most spine surgeries are elective. That means uh, it's not urgent that you have to have the surgery the next day or you're going to get paralyzed, right? It's really rare. I mean, maybe I see patients once a year where it's emergent, where I have to take them immediate to the surgery, right? So
Yeah.
it's like getting a hip replacement. Like, I've had a lot of family members who need hip replacement surgery, like my aunts and stuff. And I'm like, okay, like, let me do the research, because a lot of them are, in California. And that's basically what I'm doing. I'm researching the guy and seeing years of experience. Is this something that they're good at and do a lot of? And I ask my colleagues, do they know this guy and what's the real deal, right? I mean, that's the way I would go about that.
Um, I love that. I see you stay active, Dr. Jazini. I've seen on your Instagram you like to go skiing, you like to do all these things. What's one daily practice or lifestyle habit you recommend to your patients? Say to keep their spine healthy. What's something that you
I
tell all
think
your
there's
patients
two
to do?
things. I think one is core.
Okay.
Figure out a way to build your core, and the core means your not just your abs. That was a misconception I didn't even know until I really delved into this. It's like the analogy I like to give, it's like a tree trunk. The tree can't become a massive sequoia tree, for example, without a massive trunk. The reason it has such a massive trunk because it's got to support its branches, which are also massive. But you can't build those appendages without a good core. And so before you go to weightlifting, which is also really important, and that's the second thing I would highly recommend people doing, is build your core. And I love yoga. You can do Pilates. There's all sorts of um, other gyms like Solid. I don't want to throw names out there, but like Solid Core, that's really helps you build your core, right? And you got to do that like 3 or 4 times a week, at least. And then once you get a good foundation, I think heavy weightlifting with the proper form. And if you need to get a personal trainer, I would highly recommend that, or in the conjunction with a therapist or a chiropractor, so you don't injure yourself. Like I remember I first started out doing weightlifting, I did it through CrossFit, and I didn't do it the proper way, and I was getting injured left and right. But now that I've done 5 years of really good core work, the sculpt work, and I've reintroduced weightlifting with the past year, and knock on wood, I haven't had any injuries because lo and behold, the trunk is stronger, right? So I don't think it's magic, right? I think you have to make an intentional regimen about what you want your body to look like in terms of your physique, in terms of your fitness, in terms of your nutrition level, um, and you got to make it a habit, right? That's my takeaway, or what I've learned through my own personal experience is you got to be intentional in everything you do, and just like whether you're going to be intentional in terms of working on your relationship with your significant other, your parent, your children, your body is ultimately, you got to take care of it. It's like anything else. Like, uh, we
We've
all live on
only
a borrowed time, and you might as well live it in the best shape possible. And you can do better for other people if you take care of yourself first, both mental and physical. So the other part of yoga that I love is the mental piece of it, the mindfulness that it teaches you, and to take that, take that moment for yourself to reset. Otherwise, the hustle and bustle of life and the stress and anxiety and the cortisol and all the negative effects of that just will destroy you. So,
thanks for dropping today, Dr. Jazini, because it's just echoing. Everybody, you've only got one spine, and I'm telling clients all the time: strengthen your core, strengthen your core. It's not sexy, but you've got to do it to maintain spinal health. Keep consistent, like Dr. Jazini's saying. Dr. Jazini, where can people learn more about what you guys do at Virginia Spine? How can they connect with your team or get on a consultation call if they're interested in talking
yeah,
with
so
you?
our website is spine, M as in mom, D as in dog.com. And the phone number is 703-709-1114. We have a great website that we've spent a lot of time trying to make sure we have really good information there. But we have a phenomenal team as well to help get our patients plugged in. We have a patient ambassador team for all our out-of-state patients and around the world. Um, One group of people that I've seen more recently is Canadians. Believe it or not, there's so much delay in care that you know I had a guy from Calgary. I mean, talk about the distance to get here. I mean, um, so yes, we have a very good resource for a lot of patients all around the world that we can hopefully help, and our mission is to help, you know, anyone that we can.
Well, every patient that I've sent over to Virginia Spine just raves about how professional and just well taken care of they get when I do refer them there. So anyone that's listening, if you have any questions about spinal disc replacement, if you are anticipating any type of surgeries, or like you were saying, any of the non-invasive treatments that they do at Virginia Spine, I highly, highly recommend. I love that you guys do trainings every Friday. What's to come at Virginia Spine, Dr. Jazini? Do you guys have anything coming up in the future, or any new services you're bringing on?
So we're really working on our neurology concussion program for athletes and for firefighters and first responders. That's an area that we've put a lot of resources to make that better and make that process more streamlined. Another area is on recovery, is by a recovery program institutionalizing a very regimented, streamlined to help our patients quickly get better, right? So if they're getting regenerative treatment, we can shorten the time of delay between that treatment and the recovery piece. And so working with our therapists and our other colleagues, we're trying to really reinforce that. That's an area that we've done a lot of research on, and on the ground with our team, right? I can't do this by myself, right? We have to have that team. That's an area that we've done a lot of tremendous work, and there's more to be said and more news ahead on that venue.
Wonderful. Well, thank you so much for being on the podcast today, Dr. Jazini. I truly appreciate it. Any of you that are listening, like I said, check them out. They're the best in the area, the best in the world, probably. You've got people coming from all over the United States, from Canada, from internationally. People fly to see Dr. Jazini and his staff. So I couldn't recommend you guys enough. And thank you so much for being on, Dr.
Yeah,
Jazini. I really
thanks
appreciate it.
for having me. This was a pleasure.
Awesome.